a breath in. Good, exhale. Good. Okay, now bend your hand over the side of your head like so. Good, and I'm going to work behind this shoulder blade, all right? We're going to do a couple gentle passes like that, all right? Come back down. Good, hand down by your side. Yeah, a little more. Good. There it is. Good. Hey everybody, this is Dr. Warren Kalkstein here at Kalkstein Chiropractic in Towson, Maryland. Today I'm with Rachel, and Rachel is one of our head trainers out on the exercise floor. She's been working with us for 2.5 months. Okay, I think that's about right. You're coming up on your 3 months as a trainer along with the chiropractic work that we do here. So in our office we have a full gym, and Luke can put a little flash through the gym there, and that's where a lot of our patients kind of develop, both from a physical therapy standpoint as well as from a strength and conditioning standpoint. And Rachel's been really helpful over the last 2.5 months of being instrumental in guiding people through that process of going from pain to fitness. And it's been a joy to get to work with you. I appreciate all the hard work, and I think we have a really nice balanced team out there with Andrew, Rachel, Sabrina, and with Michael, who's new to the team. So hopefully we'll get to introduce you guys to them going forward. But today's video is about how a combination of fitness and chiropractic is a really nice marriage of two different modalities of creating wellness and health for our bodies and for just ourselves in general. So my focus, my intention is here on the table is working with people, getting them moving better, getting them the alignment, getting them healthy movement in their joints, and taking pain away from certain problems and clinical conditions. Rachel's job is to take that body that's moving well and to challenge it and to stress it and to create the change that we need around certain tissues to make us more resilient to the day-to-day strains of, you name it, right? And so I think it's been a nice combination of things from our standpoint, and our patients love coming in to get adjusted before they work out. And I hope to continue to grow that aspect of our practice. I think it is instrumental and is really becoming the foundation of what we do beyond the pain management side of things. So I take us back to Rachel. Rachel, you came in as a patient, and you were a patient maybe 3-4 months ago, and we were talking, both of us come from a little bit of a strength and fitness background, so we connected over that, and you were a trainer at the time. You came in with some low back pain, and now you've been working with us ever since I said, hey, come join our team, and I'm really grateful that you did. Going forward, she's had a little irritation to a rib in her mid-back and some muscle spasms around that area. And so she hasn't really gotten a lot of treatment for this, maybe one session, and maybe a little Theragun work, which is helpful for you as well. So I'm going to show you the ART that I do for an iliocostal or rib strain, as well as the muscles that we work on to help her have better mobility. And then guess what you're going to do after this? You're going to lift, you're going to work out. So there's a couple ways that I can get into that space and work on that rib. I'm going to show you a standing version where you're just kind of leaning into the table, and go face down for me if you don't mind, Rachel. Rachel, step up for me. How about we do this real quick just so people understand what is the experience of the discomfort that you have in that area? What does it feel like?
It feels like my low back is very tight and I just feel constricted, like I can't move properly.
Okay, and then the pain that you feel in this area here, when does that bother you the most?
It bothers me the most when I turn side to side.
Okay, and now do you ever have pain when you're lying on your side at night at all?
No.
Good. And then do you ever have pain when you're lying on your back?
No.
How about when you lift overhead? With weights? Ever tweak it, lift it all overhead with weights?
Yes.
You do?
Yes.
Okay, gotcha. And is it a barbell that aggravates it, or is it a certain exercise that you know that kind of tweaks it a little bit more than others?
It's usually working the posterior lower body.
Okay, gotcha. All right. So we're gonna, just with the information, and I've treated her before and examined her before. She moves really well. She's very healthy. She just has a little bit of a local irritation to a muscle and a joint. And so let me show you how I work on that area first. Okay. So I'm gonna lift this up a little bit here, Rachel. Okay. There's a couple reasons that I have it standing, as I can get different leverage around the muscle, and as well as it's easier for her to push off her feet so that she can extend her right hand a little bit easier. And you'll see what I mean by that in a second, Rachel. So reach your right hand up above your head. Good, and just kind of go ahead and drive through this leg and get tall. There you go. Good. Now bend your hand over the side of your head like so. Good. And I'm going to work behind this shoulder blade, all right? Okay. We're going to do a couple gentle passes like that. All right? Come back down. Good. Hand down by your side. Right over here for me. Okay. And then reach it up. Good. And bend it. Good. So you'll see I'm doing a lot of videos here because here you go, reach up for me, with staff, because I've just been busy with patients during times. It's hard to kind of step aside and do a longer video like this where I'm doing a little bit more education and talking through some things. Reach, reach, reach. And it's also a nice time for me to relax, just to work on the staff. I really appreciate what they do here. It's a nice time for me to just step aside and catch up with them as well, to see how they're doing on, say, for the exercise floor in the back of the house, or the people that work at the front desk, like Gabriella was holding the camera. We got an amazing team, a lot of great individuals, people with good values working here. So it's nice to highlight that. Reach, good. And now I'm gonna push, okay? Good. I'm gonna push down on your hip. Good. There you go. And right in there, okay? Is that the area you would say, you just pushed your thumb right on the spot that's irritating me? So when I get over that spot, it just has a different tension, it has a different feeling, it has a different end range. It's right there. I'm going to push into it, and I can feel, and we'll call this a little bit of probably an injury from, probably a lift, where she strained that tissue. That feels like a strained tissue. It's going to have a deeper, it's going to be pretty uncomfortable when I work on it, but it'll feel good. You doing okay with that?
Oh yeah.
Awesome. Now reach again for me. And relax. It's not necessarily a muscle spasm, but a strain itself. Easy. Good. Now I'm going to work it. Breathe in. Exhale. Feel how it kicks off right there? The tone is a little bit different from the different, that's the iliopsoas muscle. That's the muscles that run the length of your mid-back, that kind of splay out like this. You see how on bodybuilders they can really define sometimes on the back. Right there. Good, settle. Okay, we're push through it. Run all the way up it. And now we kind of relax everything around it, and now it's just jumping out of my hand. Reach. Good. Now I want you to let your arm fall down to the side now, okay? Just let it hang. So I'm taking my thumb, I'm pressing through and releasing it across. And only so much of this, okay? We're gonna do just a couple more passes because, again, you're about to go lift. I don't want you to be overworked in that muscle. There's a fine line between enough and too much with this. Just easy movement in your mid-back, okay? Take a breath in. Good, exhale. Good. Okay, lift your chin up, look forward, rest down. Good. And relax. Right there. Come onto your right side, left side up. So you're quick with it. You feel right away when I felt it too.
Yeah.
It's good. Good awareness. Here, right here. Relax your shoulders. Good. So you're gonna feel a stretch, and you're gonna feel that segment that you nodded your head on come to tension and release. Good. Good. Come on your back. Let your legs go straight. I'm going to put my hands on your hips, okay? So this is just a different way to shear the SI joint. I'm feeling low on basically your pelvis to your sacrum. I'm just seeing how they're gliding. Tell me what's going on here, to here, to here. I'm just picking up different feedbacks from the muscles, but also the joint, your low back, okay? So I'm going to check your hip. So different ways of doing a psoas muscle one by myself. I'll show you how I do it. So I do it just a light compression over the front. Take your knee, drive into my hand. Yeah, sorry, this way. Go ahead and pull up, pull, pull, pull. So I'll feel that engage. All right, that's generally where the psoas is coming down off the spine and coming in attached to the inner thigh, to your lesser trochanter. So relax everything here. So just manual pressure into the front of the hip flexor. I do this a lot of times period. In the chiropractic world, this is like a soft tissue technique, and treating pregnant women because it's so gentle. But it just works. You don't need a ton of force to change the tone of a muscle. If I'm working out like scar tissue like that, a little strain like that you felt there, I do need a little bit more work. I kind of need to break that stuff down again so that it reforms the right way. Then you'll be a little sore in that area because of it. Okay. This will just let go. Loose. Good. Perfect. And then go on your side face that way. I'll show you the other way I can do it. So we can just go in and palpate over top of the psoas like so. I'm going to take your leg back. I'm going to hook it with my leg. And if you're flexible enough. I want you to reach your hand up above your head. Good. And I'm going to pull you back nice and easy.
Sorry.
That's okay. Don't worry about it. Did we scare you?
Yeah, that scared me. And I'm the one that did it.
And come back. And I'm going to put more pressure down. Good. You can feel the line of the muscle. You see how it rolls right now. Now I'm over the thickest part of it.
Yeah.
Now I'm going to press down on top of it. Good. Now pull your knee to your chest. Keep going. Keep going. You're really doing quad, 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 quad. Now harder. There's your psoas. You see how it kicks on a little bit more here. And then let it all go. Good. Extend the knee. And then I'm going to straighten out. I'm going to shorten the quad out so it's all hip flexor. You feel it just in the front of the hip. Good. Nice gentle way to move that area. Okay. I'm going to adjust your low back. I'm going to jump over all this stuff that just tried to attack Gabriella. Go. There. And then cross over here for me. You come over here, Gab. Good. And relax. Alright, so really easy here, okay? So I'm rolling all the joints into extension, feeling how they move, and I'm coming right to the sacrum to adjust you, okay? So it's more SI focus, just there. You see how like that's a little lower, a little deeper? You move well. Good. And I'm going to check extension a little bit. Loose. Breathe in. Yeah, a little more. Good. There it is. Good. And come on your back for me, okay? Perfect. Alright, so we went from working on a rib spasm to your low back, your psoas. And now I'm just going to adjust this hip and you're ready to go work out, okay? Go. Loose. It doesn't challenge you very much when it's loose like that. It's good. So I'm checking the ankles, the knee, the midfoot. See how good you are. Feel that? Underneath the middle finger right here. Feel how that glides smoothly underneath my finger? Yeah. So I'm going to expect to move that signal. I could be wrong, but enough practice. Focus. Usually I can get right to it, you know what I mean? I've been given enough good opportunities to help people out. Let's just say it like that. And some good teachers as well. That's the reason I can do it. How you feel? I hope so. Awesome. Have a great workout. Appreciate your help out there. If you've got questions about what I just did, just post them below. I'll read them and get back to them. And thanks for watching so much. Thanks for letting me treat you, Rachel.
Thank you for doing me.
Yeah, absolutely. Cool. Thank you, guys.